Good afternoon, members of the committee. Good afternoon, Honourable Minister Shana Fernandez. A couple of people online. Most of the participants seems to be online this afternoon. I greet you all as well. Robert McDonald, HOD. I believe you're online. Thank you, Robert. You and your staff. All the officials, members of the public, and everyone joining us online, you are most welcome. Just some house rules. I think very important for us to focus on the house rules as well. Mute your microphones. That's very important. The chat function, as you're aware, is only to be used if you want to speak, bringing something under our attention for us to see your hand, and raise your hands only when you want to speak. Advise everyone to turn off the mics, the videos when not speaking, and switch off your mic when you want to speak or when you are done speaking. I'm not so sure, Secretariat, with me, if you receive any apologies from any member.
No apologies, Chair. I did not receive any apology. Members are here.
And maybe officials from the HOD side, Honourable HOD.
We received an email from the HOD, and he advised that he will be joining the committee online.
What I want to know if the HOD have any indication, any of his senior staff that are supposed to be here, not present.
No.
Thank you, Chair. We have one of our chief directors, Ms. Marion Johnson, is off sick at the moment, so she will not be joining us. The rest of the senior managers are in attendance. Thank you, Chair.
That's what I'm talking about. Thank you so much, HOD. I highly appreciate it. We note that. And let me get to the introduction of the members. I'm Dan Plato, Chair of the Standing Committee, and all the others with me. Please do it yourself. Thank you.
Thank you very much, Chair. Khalil Brankais, member of this committee. And thank you. Good afternoon to the department also. Thank you very much.
Thank you so much.
Good afternoon, Gladys Bakbakufos. I'm the member of Social Development Standing Committee. Thank you very much.
Good morning, Chair and MEC and the staff. My name is Rachel van Voorgang.
Thank you so much. Those online.
Good afternoon, Chairperson Ricardo Mackenzie.
Next person.
Good afternoon, Chairperson. Good afternoon, Minister Wendy Kaiser-Philander.
Thank you so much, Honourable Member. I think that is it. Let me just hand over to the HOD to do the same with one or two of his senior members before I hand over to the Honourable Minister.
Thank you very much, Chairperson. I'm Robert McDonald, Head of Social Development in the Western Cape, and then I'll ask the others who are online to introduce themselves.
Please, those that are with me, please do that.
So I see we have the Head of Ministry, Nanda Nell.
Good afternoon, Chairperson and Minister and colleagues.
And then Mr. Jordan.
Good afternoon, Chairperson and honourable members. I'm Charles Jordan, and I'm the Chief Director for Children, Families, ECDs and Special Programs. Thank you.
And Ms. Goosen.
Good afternoon, honourable members. I'm Leana Goosen, Chief Director, Social Welfare and Restorative Services. Thank you.
Mr. Hewu.
Thank you, Chair. Thank you, HOD. Good afternoon, Chair and honourable members. I'm Zondi Hewu, Chief Director for Community and Partnership Development. Thank you.
Thank you. And then we've got Siham Iftakhadin.
Good afternoon, Chairperson and honourable members. I'm Siham Iftakhadin, Director, Business Planning and Monitoring.
And Ramula Patel.
Good afternoon, Chair and honourable members. Ramila Patel, Director operational management support. Thank you.
And then Ms. Jonkerman.
Good afternoon, all members. I'm Mashanet Jonkerman. I'm the Director of Facility Management. Thank you.
And Mr. Miller.
Good afternoon, Chairperson and members. Gavin Miller, I'm the Director for Research and Information Management. Thank you.
Thank you, Chair. And then the rest of the team is present in the room, so I'll and let them introduce themselves.
Thank you, Chair, and good afternoon to all. I'm Juan Smith. I'm the CFO for the department.
Good afternoon, Chair and honourable members. I'm Din Bali, Director Finance.
Good afternoon, Chairperson, members. I'm Annemie van Reelen, the Chief Director, Service Delivery Management and Coordination.
Afternoon, Chairperson, MEC and members. I'm Joshua Chigomi, the MEC's Media Liaison Officer.
Thank you very much. I think that is it. Honourable members, before I hand over to the Honourable Minister, may I ask you, I would love to remove my jacket. Would that be in order? It is so humid, so hot in here. Thank you. The members agree. Thank you very much. I had to ask first. You may even take your tie off. I will at least keep my tie on. Okay. Thank you for allowing me to do that. And Honourable Minister, it's all yours with your intro and immediately after you, your HOD.
Good afternoon, Honourable Chairperson, members of the committee, officials, members of the community and media. It's indeed a pleasure to present our DSD budget vote. Ms. Shamsi, good afternoon to you too. Firstly, allow me to congratulate the Chairperson on your appointment. We have in the past enjoyed very robust yet dignified engagements with this committee, and I would like to inform that we are willing to continue to that relationship and to be accountable, but in a spirit, in a very good spirit, the meetings were conducted. So I wish you well as you navigate this committee through the next however many months we have. Honourable Chairperson and members, it's been a difficult year for Team DSD. We have had the impact of COVID has affected our department particularly hard because it affects the most vulnerable. And we have seen an increase in the number of cases presenting. We have seen an in-migration to the province. We have seen settlements emerge during COVID. And so our service delivery needs to expand to meet the ever-increasing need. We are all mindful that poverty and unemployment is on the increase. And sadly, as a department, we have had to absorb a significant budget cut. And it has required that every person on this platform, and even those who are not present today, have had to apply their mind. And we have sat down as a team and realized that whatever cuts we make would have to be in the interest of our citizens and clients and the community. But it is not easy when they say you can only cut your cloth according to what you have. So we are facing serious headwinds as we go into this next financial year. It is not easy, but it's not for lack of commitment or trying on the part of the department. And we just want to assure the members that we will continue to strive to maintain the statutory services, the essential services, and that we too are looking for ways in which we can combat some of these cuts to try and ensure that we maintain that a sufficient standard of service and delivery, not only in the regions of which we have 6. And one of the other things is that COVID curtailed us during the last year. This year, now that we see a break between the 4th wave, I've actually started visiting our regions and going out there. So I can say that I have been on the ground and I have seen the food queues, I have seen the poverty and the unemployment. And as a department and as honourable members I am sure we all share the same concern around rising unemployment, poverty, and an increase in crime, which has also impacted our department because we have staff who got hijacked, we have staff who've been pistol whipped, and so this adds to the ever increasing demands on the department. However, I would like to believe that with this leadership team under the guidance of Dr. Robert MacDonald, who unfortunately is in quarantine, which is why he's not here. And I would like to, on that note, Chair, through you, hand over to Dr. MacDonald. Thank you very much.
Honourable Minister, thank you so much for your introductory remarks. Dr. MacDonald, please.
Thank you very much, Chairperson. I won't add too much other than just to say that this budget that we are tabling is characterized by significant cuts in most areas. We were fortunate in some respects not to have to deal with the worst case scenario that was initially projected last year in terms of the budget reductions, but it's still a lot lower than what we would have wanted. I took a look this morning at the estimate of provincial revenue and expenditure for 2019-20, and looking at what the estimates were for this financial year in that document. And with even taking into consideration the shift of ECD and other changes, we are about 85 million rands lower than we were actually going to be based on that projection. So we are sitting with quite a serious problem financially coming into the year ahead. We all know why that is, and most of the departments are facing similar sorts of issues. But obviously in social development, with the impact of COVID-19 on the economy, we are seeing an increase in demand, not a reduction in demand for services. So we are being simultaneously affected by an increased demand while we have a decrease in resources. And its impact is going to be very seriously felt in the NGO sector, where the funding for NGOs is being reduced, and also in our own operations where we are short of sufficient money for filling of vacancies, and so we will be on the back foot as a department operationally as well, and in the same boat in many respects as the NGOs we fund. So we've tried our best to minimize the damage, and the budget that we're tabling today is a compromise between all of the competing demands and the shrinking resource base. I think also there has been some specific earmarked amounts to continue to address the fallout of the COVID disaster. So there's still a sustained allocation for food relief, which is welcomed. And then also some additional allocations to assist in the Sanitary Dignity Project and other areas of material relief. So I think that there is at least some additional provision for that, but across the board, we are short in almost all respects. So I think we must make that proviso up front before we go into the discussion. Thank you, Chair.
Thank you so much, HOD. May I ask the members, you have the opportunity to ask or to raise a point of view with regard to the intro of the Honourable Minister and the HOD, or we can go directly into the meat of the budgetary discussion. Honourable Vos, you want to respond?
Sorry, Chairperson, we can't hear. I'm not sure if Honourable Bakubakafos is speaking.
Can you hear me now?
Now we can hear you. Thank you, Member.
Loud and clear. Before we start with the budget MEC, I would like to bring to your attention that I have written to the chair of this committee requesting an agent meeting where the HOD would appear to explain what he knows about Fritz scandal, of sex. But the chair has not responded to me at all, even acknowledged the letter that he received. The chair must give us date of that meeting here. We can talk about young vulnerable women who were abused in this department. So we must talk about that. When is that meeting? The chairperson, can I get a response of that before
On a point of
we
order,
start?
Chair.
But I also want to
Chairperson.
go to the...
There's a point of order, Honourable Vos, just a moment.
Chairperson, on a point of relevance, I think it's very clear to members what the business of the day is. So I would kindly ask you to rule on that statement or remark made by Member Baku Vos as to we are not addressing matters, we are dealing with the budget today. Thank you, Chair.
Thank you. I can give answer. Yes, there's a response underway and there's already a meeting date scheduled. Thank you. You happy with that?
Thank you very much, Chairperson. I really appreciate your response. Yeah. I would like, Minister, I'm not sure if you you saw to a parliamentary question by MEC Mbombo, which showed that 1,421 children died in the past 12 months in the province, including 185 that were murdered. I would like to understand from the MEC what is her department doing to improve safety of our children. And I also want to acknowledge the effort that the DST is putting, Minister. We are we know actually that in our rural areas, there's a lot of unemployment. And although we know that a lot of people are hungry and unemployment, as we are grateful of the work of your department, but we also need more. It's not enough, Minister. People are hungry, but I don't want to brush this off. I would like to see more when as the times goes on. We saw in every area in the rural queues, and there was even an incident in Kayamandi where the people just went and grabbed food that was not meant for them. Because people are hungry. When they see food, they just want food. They don't care if this food is for the beneficiaries or for whom. So I really want the minister and the department to look at that. Thank you very much.
Thank you, Honourable Member Vos. Honourable Minister, would you love to respond to that?
Thank you, Honourable Baku Vos. You are right. There is huge unemployment in our small towns. I've recently been to Maritzburg, Klaver, Genatendal, and I see the food queues at our CNDCs growing. Unemployment is real, and unfortunately, there is no silver bullet. Child protection is key. It is one of our core mandates, and I saw the response and the breakdown of the number of deaths. Sadly, DST is often at the back end of a death, and with the constraints that we face in terms of staffing, we are dealing with cases as they hit us, if you could call it that. So the focus would need to be on early intervention and preventative work, which I know that the team is working with. But I would like to hand over to Dr. MacDonald, who can give you, and also in terms of poverty, there is an allocation on the part of government, but it is certainly not enough. It will not address the large-scale poverty that we are seeing, not only across this province, but across the country. Thank you, Chair. If you may, I'd like to hand over to Dr. MacDonald.
Doc MacDonald, thank you.
Thank you, Chairperson. I think on the child protection front, you will see in the budget that child protection is one of the only programs where we've actually managed to slightly increase the amount allocated. because we recognize the importance of this area right now, and the fact that we are seeing a serious instability in the child protection NGO sector. We've had a closure of a number of child protection organizations in the past 12 months. So we've done everything we can to try to protect the sector and keep it functioning. I think also in terms of the question of child murders, there is a range of interventions that are in place and that are planned for the year ahead in the department's annual performance plan, but also in the department's role in the larger safety plan for the province. And it's a major issue that needs to be addressed holistically. So there is the child protection system itself, which we've committed to strengthen. At the same time, there is our social workers' role as part of the area-based teams that have been set up by the Department of Community Safety in conjunction with the Department of Health to improve the safety in some of the highest risk areas. The areas where we're seeing the highest rates of murders in the province are also the areas where we are picking up high rates of child murders. So the child murders are coinciding with the hotspots, the crime hotspots. And the largest number of child murders occurring is related to teenagers involved in gang activities. And that is one of the key priorities of the safety plan for the province, is to intervene and to reduce gang violence as one of the various forms of violence against children and adults in the crime hotspots. I think I can also ask Mr. Jordan perhaps to add some more detail about the child protection work that his team is doing. So I'll just ask him to come in here briefly as well.
Thank you very much, HOD, and thank you, Chair and Honourable Member, for asking this question. So there's quite a few things that we had to strengthen because of all these numbers. It is unacceptable high numbers. So the first thing we had to do is also strengthen the NGO sector as one of our partners. So we have increased a lot of positions, posts that we've additionally added to the child protection sector specifically for the NGOs. So currently we stand at about 858 social workers and social auxiliary workers that we're funding, which is an increase to last financial year, or actually the one that we're currently in. So going forward, we have increased the capacity. We've also, for the NGOs, we have added more resources to their operations so that they can be sustainable as statutory organizations due to the critical work that they do with child protection. If I look just at the kind of programs that we are strengthening, it is specifically, we've got a whole process of strengthening the safety parent system. We have picked up some gaps there that myself and Ms. Van Reenen, the Chief Director of our regions, are dealing with. Just to give you an example, for example, your safety parent is the first place where a child's been placed when they have to be removed urgently from a home. And that can happen during the night. It can happen on a weekend. So we strengthen the safety parents, who's the ones that's going to be receiving the children. On our foster care system, we have also strengthened that. And we've got various processes. For example, we actually monitor and track this 36,000 children on a system when the cases need to go to court now. We've also improved the system where we've got specific forms clearances on the child protection register before a child's been placed, that we make sure that these children are placed correctly by the right people. So the Western Cape province has got access now to the child protection system where we can actually look at Form 30s. I know I'm talking a bit technical now, but it's specific forms that we've got to use when we work with the safety of children. If I look at other programs that we're strengthening, we look at the Eye on the Child project that we're strengthening. And predominantly our NGOs work with this. It's where they've got community members that they've got, inverted commas, an eye on the child that lives in that street. So it's like a house mother that sort of look and take care of the children when their parents are at work. We've also got the Risia project, the old Isibindi project. That's where we appoint child and youth care workers from the community They receive training and everything, and they also work amongst the communities. They're also the eyes of what's happening and doing a lot of preventative work, awareness work on what parents' role should be and how parents should support their children and show them the dangers. And then we've also got various other programs, for example, specifically drop-in centers for children. So we've got one-stop centers where we actually can have children that we support them psychologically, we provide food for them, we reach out for them. And then, of course, another important factor is the after schools. There's a lot of after school facilities where children stay after school. We take care of them, they get fed, they get a lot of things are being discussed with them. This is where we pick up there's something wrong in the family, and that's then where we refer it to a social worker to see actually how can they strengthen these children, the family circumstances. You've got to have a strong family to ensure that the child is always protected within that family. It's a vulnerable family unit that also leads to the child's vulnerability. So it is very important to strengthen the family structure. Programs that we also offer and that we do is teenage pregnancy programs. We've got boy-child, we've got father programs, and we've also got parent programs. So there's lots of interventions we're trying to do. And then I think this horrible thing of children that's died unnaturally, there is death review panels between this Department of Health, universities, SAPS, and the pathology unit of the Department of Health, where every case where there is a child that's died are being looked at. And if there is any signs of unnatural death, then immediately it gets referred to us and we will investigate, because if there's other siblings in the house, that other siblings could be at danger. And then for us to investigate immediately and see how we can do that. Another major thing, and this is the last thing that we've strengthened, and it's a function that's now going to the Department of Education, it's the ECD program. We've got various teams and programs of support for the protection of children during the day in an early childhood development environment. This is where we actually create an environment to protect them, to care for them, but at the same time to give them all the opportunities in life to develop learning skills so that they can be school ready. So your Honourable Chair and Member, it's a lot of things. We're putting a lot of effort in, but this is what we're trying to do to prevent that more children become vulnerable, because we do not want to have one number of any child that has died unnaturally. Thank you.
Thank you, Mr. Jordan. May I ask at this point in time that we go through the budget page by page? Thank you. I'm on page 289. Page 290. Page 291, honourable members. It is for you to put, Honourable Vos, thank you for putting up your hand. You may go.
Thank you. Thank you very much, Chairperson. Chairperson, on page 290, on the second paragraph, the second sentence, I would like to ask a question there. How has the population growth and rising unemployment added pressure to the department service? And how is this budget responding to that? Secondly, how many child-headed households that have been created by COVID-19? And what is the total of such households that we have in the province, as well as support packages given to them? Thank you, Chairperson. And the second one will be on still page 290, the third paragraph, on the second sentence. I would like to know, instead of providing meals and supporting community kitchens, what other programs are in place to support the needy people? Secondly, what is the possibility of increasing the number of CNDCs and expand their mandate to also give groceries to families, especially during long weekends and December holidays when they are closed? The last question, Chairperson, is on the third paragraph, the last sentence, still on page 290. What is the number of social workers and social auxiliary workers employed in shelters? Where there are any shortages of this, when will the department apologize for their role in the establishment of the Strandfontein concentration?
Thank you.
Homeless adults and their families. Thank you very much, Chairperson.
Honorable Windvogel.
Thank you so much, Chairperson. Chairperson, mine is on page 291, the second paragraph. The point of reference there is the Western Cape is home to 2.4 million youth between the age of 15 and 34. Unemployment, social pathologies such as substance abuse and gang-related activities, and the negative impact of the lockdown measures on the educational and little employment opportunities, coupled with the weak South Africa economy, continues to have a negative impact. Now, during our Standing Committee on Health, the MEC mentioned, or she stated that the service pressure at hospitals were caused in part by mental health patients, especially youth on drugs. So I therefore want to understand from the MEC if her department has had an engagement with the Department of Health on how to address the drug abuse challenges. Then, Chair, how does this budget speaks of response to the increased substance abuse in the province? And do we have a youth development strategy in the province which speaks directly to address these social pathologies? Yeah, Chair. Then lastly, Chair, on paragraph 292, sorry, page 292. So we stop at 291. Okay, no, it's fine. Then let me park there. Thanks, Chair.
Much. Honorable Ahmed, sorry, Brankes.
Thank you very much, Chair. Chair, on the first page, 289, on the first bullet, the mission of the department empowers the poor. I want to ask from the MEC that considering the situation in Ukraine and in Russia at the moment, we are looking at the next couple of months where we're going to see a lot of increase in food prices and fuel prices, and probably many other prices is going to skyrocket in the next coming months. And we know what the reality is here on the ground in the Western Cape with, with the poverty and the hunger that is, gripping this province of the Western Cape. And we also consider the financial constraints of the department. So my question is that what is the possibility that government can work with private business, so that we've heard in the previous SOPAs where the Premier have addressed us in stating that the Western Cape really the mission of the Western Cape government as a whole is to ensure that each and every citizen goes sleep with a hot plate of food. So coming back to what my question is that what is the possibility that government here in the Western Cape, I mean, how many Pick n Pays is there in the Western Cape? How many ShopRites is there in the Western Cape? How many Spar superates is there, outlets is there in the Western Cape? And I can go on Checkers and the whole happy lot. I think the only way looking at the financial constraints, not only of this department, but as a Western Cape as a whole, we really have to look in that direction to work with private business and what better time to do it, than now. Winter is also approaching, and the prices that we are talking about that is going to skyrocket is already here on our on our doorstep in the form of fuel prices that is going to skyrocket very, very, very soon. So please, MEC, if we can respond to that. Thank you very much, Chief.
Thank you, Honourable Brunkhuis. Honourable Philander and Honourable Mackenzie.
Thank you very much, Chairperson. Chairperson, with reference to page 289, in terms of the core functions and the responsibilities of the department. Now, I do hear and I know, Chairperson, in terms of the lower budget projections, the competing demands of the department and so forth. Chairperson, I would like to ask whether the department has, in the light of that, any other innovative measures to supplement those key areas that really needs the attention. And then, Chairperson, secondly, in the education meeting this morning, one of the questions were in terms of children not attending school, but receiving SASSA grants. And the department then mentioned that that is where the department DSD comes in. So I would like to know what is the program, what is the process in terms of DSD, what is the function of Provincial DSD in securing that kids back to school, or either should kids not be attending school, reporting them then as recipients of grants whilst they are not in school. Thank you, Chair.
Thank you so much. Mackenzie, Honourable Mackenzie.
Thank you, Chairperson. Chairperson, we're going to get to the annexes later on, so I'll just ask my general questions for now. From the Minister and the department, we know that our social workers do extremely good work in our communities. I just wanted to find out from the Minister or the HOD, what support structures are we put in place for the forthcoming year to support our social workers working on the field? We know that they're working under difficult circumstances, going to gang neighborhoods, etc. So what support structure do we have in place for our social workers to deal with their personal mental health and security concerns where they go and work? And then my second question will be to the Minister. We've seen last year, or the year before last year, social development really came to the party. I think you've spent 53 million rand, if I remember correctly, on food relief during extremely difficult circumstances. And I just wanted to find out, are we expecting similar relief coming in this financial year, or special relief, because we know times are tough and some of the members have already mentioned it. Thank you, Chairperson.
Thank you so much. Honourable Minister, you and your HOD, you have to determine who's going to answer what.
Thank you, Chair. I would firstly want to say thank you to the honourable members for the questions. They're real pertinent questions that keep me awake at night. And one of the big issues or questions that I posed, what happens if the fuel price goes to 40 Rand a litre? How does that affect government employees who actually need to use DGs to deliver services? So before we even think of providing the service, what would the impact be? And it's not just DSD. It would be all government departments that are reliant on government transport to access or to get citizens to access services. So that for me is the starting point. Honourable Brunkhuis, the importance of public-private partnerships couldn't have come. This is the time to be engaging. In my personal capacity and as a department, we have met with the American delegation. We have met, Premier and I met with the Lotto, because we noticed that the Lotto money that's coming into the province doesn't equal the money that's going out. And we even have a project in Drakenstein, an ECD project, where we have ECD, FNB with an ECD desk. FNB has actually established a department to deal with early childhood development. But as you know, from the 1st of April, the early childhood development function shifts to that of Western Cape Education. We have allocated funds, but I'm not going to go in. I take it the team have captured the questions, but I do want to say that the challenges we face are not DSD challenges. They affect the whole of society, and it requires a transversal approach, which is what we have built into our recovery plan, where the first focus is on COVID, the second focus is jobs and economic recovery, because with a job, you can dodge a bullet, you can dodge a lot of things. The third aspect is safety, and there's a lot of work done in the area-based teams, and our Chief Director, Charles Jordan, drives the social cohesion subcommittee of the area-based teams. And then the fourth part is dignity and well-being, and that is where we focus on food aid, food security. Agriculture is doing some great work. So I'm sharing this with you so that you can see we're not working in silos any longer. In fact, in the dignity and well-being stream, we have 5 ministers, and we put a plan on the table that addresses school dropouts, teenage pregnancies, poverty, homelessness, gender-based violence. And so that is slowly starting to come together now. But the department has a specific role, and I would like to hand over to Dr. MacDonald and possibly Chief Director Charles Jordan, who is acutely involved in navigating our way as we set up the area-based teams across the province in the hotspot areas. Thank you very much, Chair.
Thank you so much, Dr. MacDonald.
Thank you very much, Minister. I think the question that Minister was talking to specifically was around Honourable Van Voorkel's question about the various pathologies affecting the youth in the province. We can speak to that in some depth, I think. But maybe just to start with the questions in their chronological order, as I've noted them down here, and then we'll try and get through them in that fashion. So the first question from Honourable Member Baku Vos was how the population growth and growing unemployment to put pressure on the Department of Social Development. I think some of those things have already been touched on, but essentially what we're seeing is a population growth that is far outstripping the GDP growth in the province, just as it is in the country. And what that means is that the population on the whole is getting poorer. Also that the population growth is outstripping the growth of the personnel in the Department of Social Development and the personnel in the NGO sector. So there are more, as the population is growing, we are not growing with it. So it means then that the ratio of people who need services to the people who are in government to render the services is changing, and the caseloads are becoming higher, and the waiting lists start to grow for services. So that is a problem that I think affects most departments, particularly as we've seen in the municipal space as well. And it's the same for social development. So the impact, the most immediate and overall impact of the population growth is that we as a department should be growing with the population so that we can maintain the ratio of social worker to population. And unfortunately, that's not happening. We're falling behind. So that does mean then we become less able to meet the need because our staff are burning out. The NGOs are becoming overwhelmed, and we are struggling to maintain service standards. So that means we have to start to prioritize and direct resources to the most critical services that we are constitutionally and legislatively enjoined to render. And that means we have less discretion about how we direct funding, because we have certain obligations to meet that are set out in legislation. I think also that the growing unemployment, of course, has created a great demand for material support. Social development is one player in that space. We have introduced the food relief, additional food relief, but the major player is actually SASSA. And of course, SASSA has for some years now been providing the COVID support grants as an additional grant over and above all of the other grants that it offers in its system. But I think SASSA is also experiencing similar challenges with capacity, particularly now that this extra money is coming through the system and they haven't got any extra administrative capacity to actually distribute the funds. And we're picking that up in the rural areas, especially where a lot of people aren't able to access the funds because the distances they have to travel to get to a SASSA service point, and the SASSA officers are overwhelmed. I think the other aspect, of course, with the increased unemployment is that it does tend to drive an increase in the social pathologies, such as substance abuse, homelessness, as well as gender-based violence, and child safety is affected as well. There is also a growing elderly population in the province, and we're going to see more and more vulnerable older persons. And again, that means more need for services in the social sector. The second question from Honourable Member Baku Vos related to how many child-headed households there are or that were caused by COVID. We don't have the specific breakdown of households that became child-headed households due to COVID, but there are a total of 28 child-headed households in the province at the moment that are on the department's database, and that the department provides support to in various forms. So we are providing a range of services to those households, including funding NGOs that offer psychosocial support to the children, material support, as well as helping them with school attendance, homework, fee exemptions from schools, and so on. Our social workers also assist where needed, and link the children to resources in the community in various ways, and also help them when they get older to prepare their CVs and apply for jobs, and so on. So that there is support provided to child-headed households by the department and its funded NGO partners. The third question from Honourable Member Baku Vos was that besides the community nutrition and development centres and community kitchens, what other support is available in terms of food relief, especially during long weekends and holidays for families? Well, in terms of food relief, there is also food provided by the department through its various NGOs. So drop-in centres provide food to children on an ongoing basis. There's also food provided at homeless shelters. There's food provided in old age homes and disability care centres, as well as daycare centres for the disabled. There is food relief for older persons through the older persons service centres on a non-residential basis, where food is provided in the community. And then also the creches and the after schools provide food as well. So there's quite a lot of food relief that is provided by the department as part of its basket of services. But again, I think also the major injection of resources to assist with material support does come through SASSA, with the COVID grants, as well as the other child support grants, disabled grants, and pensions, and so forth. The possibility of expanding further the number of CNDCs at this stage is not possible for us. As I said, we have faced budget cuts, so there's no room to expand. Unfortunately, at this stage, we are limited to what we already fund. But at least we are able to sustain much of it due to the extra funds provided by Treasury that are continuation of the extra funds provided last year as well. The fourth question from Honourable Member Baka Vos was on the number of social workers and social auxiliary workers employed in shelters for homeless adults. I will ask Mr. Jordan whether he has that ready to hand, but if not, we would probably have to provide that to the committee afterwards. But I'll just check with Mr. Jordan whether he does have that number.
Yes, HOD, we've got 56 homeless shelters, and we give to each one of them a social worker and a social auxiliary worker. So there's about 56 social workers in the NGO sector working just with the homeless people. And then they've got assistance from a social auxiliary worker, which is about 15 of them. Thanks.
Thank you very much, Mr. Jordan. And then the last question from Honourable Member Baka Vos was whether the department would apologise for Strandfontein or the shelter in Strandfontein. That shelter was established by the city, so we didn't have a role in the establishment or running of that shelter. But I do understand that there's other processes around that shelter that are occurring at the city, looking into some of the issues that were flagged in that process. But the Provincial Department of Social Development doesn't have didn't have any role in the establishment of that shelter. Then we come to Honourable Member Vin Vogel's questions. The first one is how does the Department of Social Development work with the Department of Health on the issue of substance abuse? I will ask Ms. Goosen to speak to that question. Thank you.
Thank you, HOD. We, due to the technical process with regards to substance treatment, the one can be that it's dependent on the type of substance that the person used, and for that is withdrawal necessary, and we utilize the services of Stikland Hospital for that purpose. The other one is the mental health issues that is drug induced. Unfortunately, treatment are not possible during that mental health mania phase, and therefore we have this partnership with Department of Health in terms of addressing that. The normal crime prevention and substance prevention programs in schools and in communities contribute to reducing that numbers, but Department of Health and us have this co-responsibility in terms of the substance field. Ours in terms of treatment and theirs in terms of the health component. It's heavy on both of our resources. So if the one do not do their part, then the others can't function, and therefore we have set up on a CD level quarterly engagements with Department of Health to address challenges that or fields of service that is relevant to both departments.
Thank you very much, Ms. Goosen. The second question from Honourable Member Vin Vogel was whether the budget speaks to the growing substance abuse problem in the province. The substance abuse program has been cut as one of the programs that has had budget cuts due to the budget cuts that we've had overall as a department. So there will be reduced resources to address substance abuse during this year. The attendance at substance abuse centres has actually dropped during COVID and has continued to remain lower than usual. One of the issues that we've picked up is that people are reluctant to go to treatment centres. And so there's been there's currently a process of looking at alternative ways of reaching people and trying to get them into services. But at the moment, the demand for services is actually lower than it has been for a long time. And particularly in the residential programs, there's a lot of unfilled bed spaces. So it also depends on the area. There are some areas where there's still some pressure on the system, but overall we've seen a reduction in demand for substance abuse treatment services, even though we know that it's not necessarily a reflection of a reduction in the problem. But there is a reluctance to come forward at this time. So getting referrals right and getting people to feel confident enough to come and start treatment programs again is something that we're working on. The other question, the last question from Honourable Member Van Goorgel, is around programs aimed at the youth and the social pathologies that the youth are experiencing. I think it's important to mention what the Minister was speaking to in the beginning, and that is that there is a transversal approach to addressing safety, but also to addressing youth's needs in the province. And there is a transversal youth focus area that's been established under the leadership of the Department of Culture Affairs and Sport, and with the participation of all departments that are involved in the well-being and dignity cluster, which is all the social sector departments, as well as community safety and economic development and some of the others. And essentially, it's focusing on youth opportunity development, but also on addressing youth risks, and it works quite closely with the safety side of things. But within social development, we have particular programs aimed at youth development, and I'll ask Mr. Heu in a moment to speak to some of those. And then we do also have programs aimed at youth at risk and youth in conflict with the law. And in particular, a major part of our budget and major amount of our human resources goes towards running child and youth care centres that are secure care centres for children who have behavioural challenges, who are involved in substance abuse, or who are in conflict with the law, have been arrested and charged in terms of the Child Justice Act. So there is a major area of work in the department, and the child and youth care centres in the department are currently under heavy pressure and are very, very full with referrals from the courts of children who are at risk and who need to be brought through the programs the department offers to try and get them back on track with their lives. And these programs are very intensive residential programs that the young people are put through, some of them over many, many years. And it's the most resource intensive work that the department does. So there's a range of interventions starting with youth, starting on the side of promoting opportunities and driving youth development, preventing youth from running into conflict with the law or engaging in risk behavior. And then there's a range of services aimed at intervening where young people have already fallen into those things. So I'll ask Mr. Heu to speak briefly about the youth program and what the youth program offers in terms of support to young people in the various forms it takes.
Thank you very much, Jody. Through you, Chair. Honourable Van Goorgel, we have a youth development program within the department. In addition to what other departments are doing for young people, we've got specific intervention. For instance, sports and culture will have sport-related and culture-related interventions to support young people. Department of Economic Development look at economic opportunities for young people. And with us as DSD, we run two interventions. One, we support NPOs to run programs targeting young people. Most of those, it's the provision of soft skills and hard skills. Soft skills just to build the confidence of young people, to be able to be empowered, to draw CVs, and have confidence to interact with other young people and to look for jobs within the job market. The other one is to build the hard skills where they are taken through plumbing, carpentry, and other skills so that they can be able to be empowered to run and as entrepreneurs, to assist in communities providing plumbing, carpentry, and other hard skills related services. Then the other intervention is through the youth cafes. We've got 2 youth cafes, 12 youth cafes province-wide, which are running a number of activities for young people. Most of those are hard skills where young people are taught through some social media, the digital issues, use of computers, use of the social media, so that they can look for opportunities using the social media. And these young people are also, after they've been empowered, they are linked to other available opportunities, be it bursary opportunities, linked with the opportunities offered by the various sectors, and others are placed in jobs, permanent jobs, short-term jobs, over weekend jobs. So those are the interventions that we are running for young people to ensure that they are not vulnerable and find themselves prey to the gangsters and other related social ills. Thank you, HOD.
Thank you, Mr. Hewu. Then we going to Honourable Brinkhuis's question around the possibility, or given the escalating food prices and other overhead costs, around possibilities of governments working with the private sector to support the work that it does, including in things like food aid. We can confirm that we do already have a partnership going with a number of private sector stakeholders within the department, but also there is a forum called the Western Cape Food Forum that is chaired by the Economic Development Partnership on being as an interface with the province, and that structure has over 200 organisations on it that do work outside of government. They don't use government funding necessarily. They work with donor funds. There are also businesses represented on there that are involved in humanitarian relief work. And during the COVID disaster, we've seen equal, if not greater, amounts of food relief and other kinds of humanitarian relief be delivered by the private sector to what is coming from government. And so we have a very active private sector working in the space of social relief and humanitarian aid, and we've developed a good working relationship with those stakeholders through the Food Forum, which set up under the Transversal Humanitarian Relief Work Group, which Social Development was leading at the time, and that work group continues to exist. It's now called the Wellbeing and Dignity Work Group, and we continue to maintain that relationship with the private sector through that forum. But also the Department of Social Development does have its own partnership development unit, where we also enter into MOUs sometimes with businesses, or also municipalities or state-owned enterprises to also further the objectives of the department. So there are quite a few areas where we are able to supplement the work that we are doing, which brings me to the first question from Honourable Member Philander about what measures or innovative measures we have brought in to supplement our core functions given the budget constraints. And I think many of those are relating to partnerships where we leverage benefits for the department through making it clear to stakeholders the benefit of our services for them. One such example, for example, is in the Saldanha IDZ, where we've been partnering there to obtain office space in exchange for us bringing services closer to workers there, and also where we've been brought in to help young people who are doing internships and apprenticeships to help them with psychosocial support in their journey to be trained up and become productive members of the IDZ. So there's a lot of different partnerships happening between departments and between spheres of government and the private sector, as well as the NGOs. But I think that we need to continue to be looking at efficiencies as well in the department, and there are some systems that we've leveraged to try and render our services more efficiently that we could speak to at some point. But I know that we are limited with time, so maybe just to mention some of them at a high level, being the NGO funding system, which is designed to streamline the process of dispersing funds to NGOs. The electronic foster care management system, which is designed to streamline the work that the social workers are doing in terms of capturing and managing data on children in the system. The electronic probation management system, which is also a system designed to make the probation services more efficient and create a linkage with SAPs around arrests of children. And so on. So there's quite a few systems that we're bringing in that are also going to really help in terms of making sure that we can cut overheads and save money in the department. We also are saving a lot of money on transport costs at the moment through the use of the things we learned to do in COVID, such as the use of MS Teams and WhatsApp calls and so on, which is saving us flights and other things to national meetings, as well as some travel costs to when we have to have meetings with people in different parts of the province. So all of these things help us save and have more money available for service delivery at the coalface. In terms of the second question from Honourable Member Philander on the function of social development in getting children back to school who are on SASSA grants, where a child is in receipt of a SASSA grant and there is a report made of the child not being in school. That report can be made to the social worker who's involved with the child's case, and then the social worker will do an investigation into that and report back to SASSA if there needs to be an intervention. So it will depend on who the child's caseworker is, but also these things can be reported to SASSA because we have a working relationship with SASSA, so they can also request us to assist if they need us to look into the matter for them. But generally speaking, it's best that such issues are reported to the local office of social development or alternatively to the local office of SASSA so that they can be investigated. It is a little bit tricky because some of the schools also they feel sorry for the learners, so they don't always capture the absenteeism because they don't want the learners to lose out on the child support grant. So we are finding sometimes that the conditionality attached to having to attend school that's attached to SASSA grants is sometimes can end up in underreporting of absenteeism, which is another complicating factor in the conditionality that's applied. But I think that when it's in the interest of the child is on the streets instead of in school, then it does need to be reported and it needs to be dealt with. Then the question from Honourable Member Mackenzie on the support structures in place for social workers in the field. I will ask Ms. van Rieenen to speak about some of the systems that are in place to assist them.
Thank you, HOD. What we do have is we've got the Employee Health and Wellness Program, to support where our staff members can individually access the services, but also what we've learned is if something happens in the office and we need to have a little bit of a debriefing session, then we will group them together. And obviously in our environment, we only work with a clinical psychologist. What we also have is on the safety aspects, what we have done is we have partnered with community safety, leave officers and SAPs. So specifically in Kailicha, where we had the hijacks of our staff members, we grouped together and they accompanied us with home visits, as well as we managed to get them also involved with the group sessions that we had, so that we could work with the families and also the removal of our children. They work very nicely with us, and that partnership seems to work very well in the high crime areas. Thank you.
Thank you very much, Ms. van Reelen. And then the last question was from Honourable Mackenzie about the food relief and the question of the 53 million rand that was paid for food relief previously. This year, our total budget for food relief is also around 50, I think it's about 53 million. I stand corrected, Mr. Hewu, on the exact number. But it's in the region of that, somewhere in the region
Correct,
of 50,
about 58 million, HOD. Correct.
58 million, yeah. So there's a similar amount available this year. And it will enable us to continue what we've been providing. But what we don't have is the once-off amount that was provided in the year before, which was from the National Treasury, which was a once-off amount of 50 million that was added in addition to the money that we'd received from the Provincial Treasury. So we don't have any national allocation added this year. It is only the provincial allocations. Thank you very much, Chair. That brings me to the end of the questions that I've noted down.
Dr. McDonald and team, thank you. Honourable members, let's move. I'm on page 292. Honourable Windvogel.
Yeah, Chair, I have a follow-up of, let's say, I'm not sure, are you giving me the floor? So can I? Okay, thank you, Chairperson. Chairperson, perhaps there was a misunderstanding with regards to my question. I'm not asking about programs. I'm asking about the youth development strategy in line with the National Youth Development Strategy and the integrated youth development strategy. That's what I want to know. And I think we need to do things differently because we want to feel the impact. If we are spending money on something or programs, we want to feel the impact. And I'm not feeling it. I'm not feeling it. It's like when we are going on doing things the old way year by year. And I think we really need to change our way of doing. But just if you can zoom into that's actually what I wanted to know. Thank you, Chairperson. Mr. Chair, but I'm not sure is the MEC or the HOD going to answer after the whole second round of questions?
Dr. McDonald, that question from Honourable Member Windvogel, can you pay attention to that quickly, please?
Sure, Chairperson. The youth development strategy, as mentioned, the lead department around the youth strategy for the province is the Department of Cultural Affairs and Sport. So we support that youth development focus area. And we have programs that contribute or feed into that. But the overall youth development strategy is a transversal strategy, and it is led by Minister Marais. and HOD Redmond. So I think the point is that there are aspects that fit in our department in social development, but then there are aspects that fit in a number of different departments that all come together in the provincial response to youth development. So I think that it's, we are not the lead department for youth, and we don't work in isolation. We're part of the bigger picture under the provincial youth approach. So I think that's why I explained it the way that I did. But I do understand what the honourable member is asking. I think also to say that we in a different space. As an example, we are the lead in the GBV implementation plan, which responds to the National Strategic Plan for GBV that was adopted by the National Cabinet. And so the Minister Fernandez has been allocated the role of leading that together with myself. And we work as the lead department and pull together all of the other departments that contribute because it affects all departments in the province. Similarly with youth, the lead minister in that case is Minister Marais, and they pull together the youth strategy there. So in the context of social development, we contribute, but the bigger picture is outside of the department.
Thank you, Dr. McDonald. Let me see, Honourable Philander. I'm not sure if you want to ask a question from page 292 or 293. Just
my apologies,
assist me.
Chair. It's not a new question, Chairperson. I just wanted to provide clarity on my second question, my previous questions. It's not about necessarily, perhaps I expressed myself incorrectly. It's not necessarily about stopping the grant, but rather the collaborative approach with the education department to either get the child back to school, and what the reasons are, as well as to underlying issues why the child is not attending school, and should there be problems at home. Sometimes parents draw the money, but they don't necessarily look after the children. So my question basically was just, what is the department's intervention in such a case? I just wanted to be clear on that. Thank you, Chair.
Dr. McDonald.
Thank you very much, Chairperson. Yeah, I think that is something that we strive to get right, and that is to have a multidisciplinary approach to children in that situation. And so, getting the working relationship between the school, the social worker, and sometimes the local SAPs as well is something that we're aiming to do. I think that it works quite well in rural areas, but in the metro, it can be a bit more challenging. So it depends. It depends on which area we're operating in as to how it is best addressed. I know that also the education department has its own social workers who service the children in the schools as well, and they sometimes refer cases to Department of Social Development where there's a more in-depth intervention required. So there's a lot of referral between social development and the education department, depending on the needs of the children. But we've been working with the education department over a few years now to develop a model around how social development can best support children in schools without necessarily bringing alarm to parents around the fact that social development is in the school, or the social workers are coming into the school, because that tends to be seen as something negative a lot of the time. But yeah, it is our aim is to work with the schools and get the children into the schools, and the social workers are often assisting getting children's birth certificates and things like that, so they can get enrolled in the schools, and also helping them to get fee exemptions where possible, and so on. It is part of their role. Thanks, Chairperson.
Thank you very much, honourable members. Let's move to the next page. I'm on page 294. Page 295. Yeah. Honourable Vogel, you want to say something on page 294? Thank you.
290, we are starting with 292. 395. Remember, I was doing a follow-up on the first round.
Yeah.
My question is going to be on page 2. Remember, you told me I must stop, I must start the chairperson.
No problem, go ahead.
So much. Chair, on page 292, the first paragraph. I want to know what the role is.
Chairperson, apologies, we can't hear the questions. Sorry about that.
Sorry. What I want to know under this first paragraph, what the role is the department given under the safety plan and how much is allocated for it in this budget? And then also on page 292, paragraph 2, it's actually said that some of the victims of sexual offences were employed in this department and government. And given the seriousness of sexual offense in the province, doesn't the MEC think it's necessary for the investigation reports against Fritz to be handed over to the police? I really want to know from her side. She's our leader in the province. And do this department and provincial government have a GBV sexual harassment policy? And if so, how is it implemented and how does it work? And then lastly, Chair, also on paragraph 292, what services are provided in the 11 stations and how many of these GBV shelters are in these 11 areas? And what is the department doing to respond to our call for more GBV shelters in the GBV hotspot areas? Thank you so much, Chair.
Thank you very much. Honourable Mackenzie.
Thank you, Chairperson. Chairperson, my question is on page 295. Just on is it the RISIHA model? These services will be in the form of the RISIHA model. Can we just get a short explanation? What is the RISIHA model? Thank you.
Thank you so much. And Honourable Foss.
Thank you very much, Chairperson. My question is on page 293, the last sentence. My question is as follows: given the increase in the need for more humanitarian relief support, what is total budget for humanitarian relief? How many people will benefit and what support exactly will be given? In paragraph 293 and the last paragraph, in page 293, the last paragraph, my question is, there is a high demand for psychosocial support in schools across the province. We have making calls for partnership between DSD and WCED to place the unemployment social workers graduate in schools. What is the department's view on this? What interventions will be implemented in these 11 police areas and how many social workers are deployed to them? And my last question, Chairperson, is in the last paragraph on page 294. What are the details of the GBV implementation plan and what are the tasks given to each department and how much in total in this government spending on GBV initiatives? Thank you very much, Chairperson.
So thanks for the question. You put off your mic, please, Honourable Foss. Thank you. Yeah, thank you, Vogel. Honourable Minister, I'm not sure if you want to deal with the first part, with the former MEC's part, and then your HOG can do the rest.
Thank you, Chair, and thank you to the Honourable Member. As far as I understand, the internal report, I think, is still being processed. the complainants would need to log a case at a police station. And that unfortunately requires victims to step forward. And that, of course, as I said, takes a lot of courage in the face of what has happened. I remain firmly behind our GBV action plan. I will allow the department to elaborate, except to say that we started a transversal GBV forum probably about 16 months ago. We meet regularly every month. All 13 government departments are represented. We have presentations from key stakeholders like Colonel Paulser, who heads the SAPS GBV in the province. We've had presentations on watching briefs, and the departments are now working on toolkits, GBV toolkits for gender mainstreaming. And in the Department of Agriculture, they've made some great economic affairs. They've made some great strides. So we've got a best practice model around a GBV toolkit, which every department will work with. And the sexual harassment contact officers are also a part. We're going to be bringing them in on board. In our department, we have a very effective sexual harassment contact officer in Chief Director Marion Johnson. And we have had cases, and that is an example of the robustness of the system that works. The cases that in question, and I think Honourable Baku Vos, you had put forward a question for written reply. The cases did not relate to the person in question, but it talks to the fact that we have an actual, and in our building you will see people are acutely aware of the sexual harassment policy, which I lead from the front. It's difficult because not everyone is at the same level of understanding, and this is why we drive the GBV focus internally, because I believe that if we got 80,000 employees and we get them to understand gender sensitivity, gender-based violence, and in fact, this month we host quarterly webinars in government. This month, our quarterly webinar is on courageous conversations, where Treasury is going to be leading on gender-based budgeting and what it should look like in the Western Cape. So there is a lot happening in the government space that we are actively pursuing. And then, of course, there is the VEP Forum, which just met this morning. And the VEP Forum is stakeholders, community, civil society, SAPS, NPA, NACOSA, everyone meets in that forum. And that's being rolled out across regions and the province. So from a GBV perspective, there is a clear action plan based on, and the transversal group put the plan together based on the 6 pillars as was given to us. And now that needs to roll. But I'm a firm proponent that charity begins at home. We need to clean up inside. We need to make sure that we get a common understanding within government, and then all our 80,000 employees and members of cabinet will become ambassadors for gender-based violence. And I think that's the way that we should be leading. I will ask, with your permission, Chair, for HOD MacDonald. And we also have Chief Director Goosen, who deals with the VEP program on this regarding the questions pertaining to gender-based violence. Thank you.
HOD, thank you.
Thank you very much, Chairperson. The first question from Honourable Member Vinvogel around the role of social development in the safety plan. I will ask Mr. Jordan to speak to that in a moment, but just to say that the budget allocations that have been made in terms of social development's role in the safety plan are all incorporated into our various programs. So there's not a specific allocation that's made just for the role of social development in the safety plan, but rather there have been amounts allocated in the GVV space, as well as in child protection, as well as in social crime prevention, and those amounts and the resources are then being deployed into the area-based team setting. And we've been working on crowding in resources into the hotspot areas. So I will ask Mr. Jordan to speak briefly about the social development's role in the safety plan.
Thank you very much, HOD. Yes, DSD's got a role to play specifically in partnership with various other departments. That's all part of the ABT teams. So it will be Department of Health, it will be the Department of Education, and it will also be SAPS and community safety. One example is that we do render our services as DSD. Let's take example in a specific hotspot area, and I think this is one of the honourable members have asked, is relating to the schools. So you would have that education department and DSD actually have a link in that specific hotspot area with school, with the learners in school. So if there's any issues that's been picked up with a learner at school, it gets referred to DSD, and DSD will then do interventions with the family and that child as part of our process. Other processes that we do in the ABT areas is on other normal work. So we've got in some of them GBV shelters, we've got in some of them homeless shelters, we've got various programs that's presented either by DSD or the partners of NGOs such as family programs, parenting programs, all of those kinds of stuff. We've got interventions with children, we've got interventions with older persons and the disabilities. So it's basically the core function, as HFD have said, of DSD, that where we actually specifically look at how we strengthen that. And secondly, the most important thing is to strengthen the referral pathway between us and the other departments in that hotspot area, no matter what the topic is. It's also even youth at risk. So that's in a nutshell our role as DSD within that ABT areas or teams. Thanks.
Thank you very much, Mr. Jordan. And of course, I mean, we do offer a range of different services in those spaces. So probation, diversion programs, substance abuse services, as well as GBV services and the services for children in conflict with law and children at risk. So it's about making sure that our services are made available in those areas and that we increase their capacity to take referrals from the schools and also from the other structures that are working there, like the SAPS, neighbourhood watches, and so on. The third question from Honourable Member Windvogel was, does the Department of Social Development have a GBV and sexual harassment policy, and how does it work? We do have a policy, and the Minister did mention how it works. We do have a sexual harassment contact officer, and she then assists the victims and ensures that they get the necessary support they need, as well as making sure that they can provide evidence in a way that will lead to the right outcome, and that there is that there's consequence management for those cases. I think also to say that that the policy is also part of a transversal initiative, and currently that policy is being reviewed to see how it can be further strengthened. But it has been applied, and over the years there have been a number of cases that have been dealt with effectively through that policy. The fourth question from Honourable Member Windvogel was around the services provided in the 11 GBV hotspots and what's available there, and then fifthly, what is social development doing to increase the capacity of those services, such as increased shelters and so on. I'll ask Ms. Goosen to speak to that, please. Thank you.
Thank you. Most of our GBV centres are situated in the metro, and for that reason there was a focus during the past year to expand the 6 news to more the rural areas of Eden Karoo and Issaquah on the west coast. So our GBV centers are directly linked to the hotspots. The most of them, as I said, in the Metro. We can give you a breakdown in writing, specifically in terms of what centers are linked to what hotspot. For the new financial year, we are going to focus. There's no funding reduction in this area, which is absolutely good news. And we're also going to focus on the increase of LGBTQI+ beds at our centers, as well as then some expansion in Beaufort West, Mid-Karoo, if I can call it like that. And then in terms of the other type of support services with the Tutuzela centers, Kusaleka centers, and so forth, there's also going to be expansion in at Victoria Hospital, together with Department of Health, the NPA, and SAPS, where there's also the forensic unit for victims of gender-based violence. They have holistic services at that hospital, where the forensic services are then also situated. Thank you.
Thank you very much, Ms. Wilson. The question from Honourable Member Mackenzie about the ratio model, I'll ask Mr. Jordan to briefly explain that.
Okay, thank you, HOD. Honourable Member, yes, the Risha program, it's the new name of the old Isibindi project, so it has changed name, and the word means resilience in Sotho. If I'm correct now, sorry about that, but it is resilience. So basically what the Risha program actually all involves is that child and youth care workers, community members are recruited and screened to become child and youth care workers within their community. So we've got various kinds of programs and projects that they do, and it's a whole holistic approach. So if I just look, for example, one of the organizations that we fund, they would do various things, such as they would look at children that's out of school. They will talk to the family. They will do interventions within the family. If they pick up there's issues with substance abuse in the family, they will come to DSD and look for referrals. They're actually involved even with getting children ready for ECD programs. So they would start their own ECD programs in a specific community. So it's a holistic package that an NGO that gets funded, that renders this project, will look at all of these kinds of things. They also even do provide food if they see a family needs urgent assistance. So there's a lot of initiatives that these projects initiate within a community, and it goes according to the needs of the community. So we've got quite a few child and youth care workers that's been appointed via these organizations that render these services within the community. But their main aim is to look at protecting the family, supporting family, children, and all of that. So yeah, it's quite a comprehensive package, but that's in a nutshell what they're doing. So yeah, they're basically intervening on ground floor without actually getting too much involved, because if there's statutory services, they will refer it immediately to DSD. But when it comes to food and stuff, they will actually use their own initiative to actually look where they can find food, even if it's from private donors and so forth. But they really support the community. So that's the main aim of this project. Thanks.
Thank you so much. I think that is all the questions. Let me just get it correct. Honourable Windvogel, you said as a follow-up?
Yeah. Thanks, Chair. It's not a follow-up. I just want to stop at on page 9295. Okay.
We're on track. But I don't want anyone to get the impression that I'm rushing through the meeting. I just want to make 100% sure we are now done with 292, we are done with 293, we are done with 294, and we are done with 295. Thank you very much. We are on the same page. Windvogel again.
Last question on page 295, Chairperson.
Okay, one last question. You may go.
Thank you so much, Chair. Chair, on page 295, can we perhaps get a breakdown of where these 32 shelters are and of the are and of the additional 9 shelters, how many were received from national government? Then the last one, how do we, on page 95, how do young girls who are not at school benefit dignity program or project? Thank you so much, Chair.
HOD.
Thank you very much, Chairperson. The breakdown of where the shelters are, we can provide in writing. That's no problem. The question about how many were from national government, there were 6, and those were made available by the National Department of Public Works. So those 6 shelters have been operationalized. The question about how young girls at school benefit from who are not at school benefit from the sanitary dignity program. We have distributed some of the sanitary ware to NGOs particularly during COVID when schools were closed. That care for young girls who may need the products as an additional measure. But the majority of those products do go to the schools, since that was the intended target, because the premise of the Sanitary Dignity Project was that there was an issue of school absenteeism among girl learners being driven by lack of access to sanitary wear, and hence the products being made available and the target being schools primarily. So the intention is to support school attendance first and foremost. Thank you, Chair.
Thank you, HOD. I'm now on page 296. Page 297. Thank you. Let's move then to page 298.
Chairperson, my hand is up.
Honorable Ricardo.
Thank you, Chairperson Plato. My question was actually on page 297, and also a follow-up question, just a follow-up question on the sanitary dignity project. And I want to appreciate, I know this committee 2 years ago visited the facility that does the distribution. So thank you very much for social development for this need. If we can perhaps, if the information is not available now, Mr. Monda can ask them just to send it to us. If we can get where the distribution, which schools are beneficiaries of this sanitary dignity project in the future for the next financial year. If we can just get those details. Thank you, Chairperson.
Thanks, Chair. Yeah, we would have to give it in writing because it's quite a long list.
Thank you, got that. Sorry for that. I make my own note as well for later on for our recommendations and so on. Can I move off page 297? Thank you. Page 298. Honorable Force.
Thank you, Chairperson. Chairperson, my question is on table 7.1.
Yeah.
In line with the commitment by Provincial Treasurer to protect frontline services, what did the provincial government allow for the decrease of the budget for this department? Can I take all my questions now? 300.
That is the only one on this resolution.
Yes.
Go with the next one as well. Thank you.
Thank you very much, Chairperson. Chairperson, in page 300, table 8.1, I would like to ask whether the department still has ECD function or all have been migrated to WCED.
Yeah.
But it's already
WCED is correct.
And table 8.1, what are the reasons for the budget cuts for the 3 programs and which programs will be affected? It's page 300, table 8.1. And the last question is page 300 on the earmark allocation. how many social workers will be employed through this grant and how many social work graduates are unemployed now? And the last question, Chairperson, is on page 300 on program 4. Is this a total budget for this department to respond to violence against women? Thank you, Chairperson. Thank you very much.
As I don't see any other hand, may I ask the administration to respond? Honourable HOD.
Thank you very much, Chair. On the first question from Honourable Mackenzie, Honourable Bakabaka Vos, why the province allowed for decrease of the budget to social development despite the intention to protect frontline services. I think it was obviously a total cut for the province overall. So the issue was trying to balance the cut between all the departments. So I think there wasn't any way that we could avoid some cuts being made, but I think they did try to minimize the damage as far as it could be. I think the only department, as far as I'm aware, that has actually been that's received a fairly significant boost was education, and I think they were lagging severely in terms of keeping up with learner numbers and classroom spaces. So that is understandable that education was prioritized in that instant. But in the end, the province overall is a casualty of the shrinking fiscus in South Africa. And the reduced tax revenue, reduced GDP that has come with the COVID pandemic. So we have to try to fit into that space as well as possible. But it is also a question of what the province receives overall from the national allocations. The second question from Honourable Member Bakabaka Vos, do we still have a ECD function? No, the ECD function has migrated. However, the program called ECD in Partial Care speaks to both ECD and aftercares, which are partial cares defined in the Children's Act as incorporating aftercares as well as ECDs. And in terms of the proclamation by the President and then subsequently by the Premiers, the ECD function shifted to education, but the partial cares that we call aftercares did not. So what is left behind is the aftercares, and hence there's still a line item there for the aftercares that we continue to fund the after-school centres. The ECDs have all moved over to the Education Department. There are no more ECDs funded by Social Development. The third question regarding Table 8, the question of the reasons for the budget cuts and what programs are affected, I think I'll ask the CFO maybe just to see if he can unpack that slightly, but essentially those budget cuts are reflective of cuts across the board. And as we've mentioned, there's only one or two programs where we actually were able to avoid cuts. So just about everything is cut. But maybe the CFO can just speak to the programs affected in that particular instance.
Thank you, HOD. I'm not sure if, yes, the CFO. Sorry, I must just get to the surname once again. CFO, you may go. Mr. Smith.
Thank you, Chair. Just in terms of the question, in terms of the reasons for the budget cuts, and maybe I just need to try and give an holistic picture here, but quickly. Our shortfall for since last year or this year into the new year is about, as the HOD mentioned, about 85 million. And of that 85 million, Treasury at least gave us some NPO funding of about 21 million, and then for homeless shelters we received another 3 million. So that brought it down to about 63 million, and then we had to then look within our own budget to see how we can then cut. And unfortunately, most of it was on our COE, is our personnel. So we had a recruitment plan, of about 25 million. That is for new staff that we want to appoint, but we had to reduce that to 5 million, and so we had to cut there. The same with our transfers to our NGOs. About 33 million we had to cut off our billion rand budget around that. And then also in our IT equipment area, another 4 million and so. And so we worked down this deficit in terms of that. And now with that which we had, these percentages change can be seen where we tried our best to bring about maybe some inflation, but in most cases the baselines had to be reduced. And as I said, we also had to reduce our recruitment plan for future filling in terms of that. And then, yeah, where there's increases in table 8.1, there again, we were trying to at least get back to full capacity, especially in our facilities, and then also to move towards normalizing some of our operations given the COVID pandemic. Thank you, Chair.
Thank you, Mr. Smith. HOD, I think that's all the questions asked by Honourable Vos. I'm on page 301.
So, Chairperson.
Yes, Honourable Ricardo.
Thank you, Chairperson. I just want to make sure that I heard our colleague clearly. The 33 million rand decrease, is that for the next financial year or over the MTF, the transfer to the NGOs? And what is the impact of that decrease? We know obviously that the budget has been cut and because of the economic space that we're in the country. But what is the direct impact on the NGOs on that cut?
Honourable CFO.
Thank you, Chair. Through you, yes, the 33 million is just for the new financial year. It's not over the MTF. What we can say is that our outer year budget increases slightly, so there is some positives going forward. However, for next financial year is the biggest concern that we have in terms of that. The 33 million comes in the various programs across the department, and the chief directors can speak to those specific ones where they had to then prioritize in terms of that. And yeah, Chair, so they can give the details if they need things.
Mr. Smith, may I ask, I might be wrong, the decreases, is it linked to the current COVID situation, the economical situation in the country, linked to the Western Cape as well? Am I correct or am I wrong?
Yes, that's correct, Chair. The economic situation that we find ourselves in, the prioritization around the COVID, the various waves that we had to also make sure that we fund where we can. And then also with the assistance, from national where they could, as well as with provincial treasury. But because of the funding that's available provincially, that resulted in us having to then reprioritize throughout our budget. And as normal, we would venture to try and not cut specifically where there is service delivery pressure and where there's service delivery issues. But in this case, we had to then also cut there because of the limited budget that we have.
Despite the cuts, one can take it as our programs, all our programs and projects continue as normal.
Chair, yes, this is what the programs, the program managers and the chief directors can speak to. We've tried as far as possible also in terms of our budget, as it shows here, that ultimately we came to a 0.4% decrease, which is quite minimal. And with that, we could then manage to make sure that we can still render the priority services in most cases.
May I, at this point in time, ask the honourable members? Thanks, Mr. Smith, for that detailed answer. The administration worked into our program for this afternoon, 15 plus minus minutes for tea and coffee and that sort of. May I ask? There's only about plus minus 15 pages left. Can't we not go through the pages?
We can finish.
And finish?
Thank you, Chairperson.
Yes.
If we can also perhaps just ask all the questions up to the 15 pages.
Everybody agreed to that, because in 15 minutes time we can do 10 pages. And thank you for your indulgence. I really appreciate that. Okay, let me then move. I'm on page 301. Page 302. Honourable Member Van Vogel, you may go.
Dankie, voorsitter. Voorsitter, by table 8.2, I want to know from the CFO, he explained the reason for the budget cut, but what are the reason for the decrease of transfer to NPO's? Ons weet NPO's speel 'n groot rol as dit kom by social ills in ons gemeenskap. Ek sal verstaan as ons sê, of miskien sal ek wil weet, beteken dit dat van ons huidige NPO's nie gaan geld kry nie? Of ek wil net probeer verstaan hoe dit gebeur, veral hierdie belangrike rolspelers, ons partners, om te help dat daar 'n verskil in ons gemeenskappe kom. Dankie, Chairperson.
CFO.
Thank you. Thank you through you, Chairperson. Yes, as we can see on table 8.2, it shows that there's that 33 million that I've been speaking about, that overall we had to cut from this financial year into the new financial year. And again, I want to say that we had to go and look at the work that we need to do, and to make sure that, you know, those NGOs that we are currently funding, that we can continue to fund them. The issue is about how much we're going to fund them in terms of the targets that we are setting also into this new financial year, and what those targets then also consist of in terms of that. And this is where I would think that the programs can also speak to these. Firstly, if we look at our child protection services, there we've definitely did not cut, as well, I think, in victims empowerment. But some of our other programs, we had to then also have minimal cuts, just to make sure that that we can still render the services in terms of those priority that we require. The service to our older persons, there we've stated this, and I think the HOD has mentioned this, that it is important that, you know, our old age homes and the vulnerable, that we still care for them as far as we possibly can. But we also have service centers, that we had to look at those service centers. And in some cases, because they are not within an institution, that is where also we had to look and prioritize and see where we can also cut in terms of that. And so we can go through all the sub-programs, and then we can give an explanation as to why we had to then also bring about some of the cuts.
Chairperson, sorry for interrupting. Ek wil net weet, so beteken dit dat van die NPO's gekat totally uit die budget is, of sê u net daar gaan net minder geld betaal word, transfer word na hulle toe? So ek wil net dit weet.
Yeah, Chair, what we must also understand that there will be, in some cases, there will be some less funding to those NGOs. But there's also those NGOs where there was non-compliance, where some of the NGOs could also not render the service in this financial year. So we also had to then make plans to make sure that we can still continue with the service, but using some of the other NGOs in terms of that. What we've also seen in this year is that because of COVID and the pandemic, that we had an issue with especially our ECDs, that most of them had to close in terms of the pandemic and so forth. And that we could also use some of that savings also to help our other NGOs, specifically in the childcare and support arena, to make sure that that we keep them afloat and continue to fund them going forward. Chair, thank you.
Thank you. Honourable Windvogel, you okay with that? Thank you very much. Let's move.
Chairperson, apologies.
HOD.
I think I also understand what Honourable Windvogel was trying to ask, and that is that why we chose to cut NGOs and not other things. And I think, you know, one of the things we need to emphasize is that the way the budgets have gone, we've cut goods and services category down to the absolute bare minimum in the department already. In fact, we've been doing that for years under the Treasury's cost containment measures. And at the same time, the national wage agreements have been driving up compensation costs, which has made it an increasing percentage of our budget proportion. And what that's done is it's put a squeeze on transfers to NGOs as the only area left where we can actually shift any funds, because of course with the obligations towards contracts that we have in goods and services, we can't default on existing contracts we have to service providers, and then in compensation we are obliged to pay the salaries of the employees depending on whatever is agreed nationally. So transfers is reduced because it's the one area where we actually are legally able to reduce some degree. But equally, we've been cut. We are short by 25 million on compensation as well. So there's many vacancies we can't fill. So as much as the NGOs are feeling the cut, this department has also been cut heavily, and our goods and services budgets are very short in terms of the things we need, such as petrol and other things for the social workers to get around and do the work they have to do, etc. And we're also short of money to rent office space and other things and the tools of the trade that the social workers need. So that's why it ended up that we had to also cut in the space of the money we give to the NGOs, as much as we didn't want to, considering the massive value they had. But yeah, thanks, Chair. I think that that was a particular issue that the member wanted to hear.
Thank you, HOD. Honourable Minister.
Chairperson, I would like to alert you and the members of this committee that we find ourselves in a very, very difficult space as a department. It has not been easy having to make these decisions with the pressure that we've got external pressures and we've got internal funding constraints. And I use the example of what happens if petrol goes to 40 Rand a litre. How does that impact the operational affairs? So unfortunately, as a team, we have sat down and everyone realized and had to prioritize what are key. We might not be able to increase the funding in terms of cost of living, but we're going to try and maintain funding as far as we can. And where we can't, we will reduce, but try to keep the service going. As the CFO said, the outer year looks like a better year, but this coming year is going to be incredibly tough. And this is a team of committed people who have had to reprioritize and work with what we got. But we would want your support in helping us to get through what is probably going to be one of the toughest years besides COVID. Financially, this has hit us really hard, and I need to be very transparent about that. And we are looking at innovation. We are looking at public-private partnerships. We are looking at connecting NGOs to US aid and whatever else, other mechanisms there are. But it requires all of us to work together to try and make this happen. Thank you very much.
Thank you, Honourable Minister. I think it brings me back to what Honourable Brunkhuizer said at the very beginning, the impact of the war with regard to all of these issues. But I don't want to go into that discussion right now. That is an issue on its own. Let's stick to our own business right down here. I'm on page 302. page 303. I don't see any member here online. Member Force, you may go.
Chairperson, can I start? You said 302, ne? Can I start to 302 to 311?
Oh, you take it too far, but let me see. Let's go and get it over and done with. Let's go. Honorable Force is all yours.
Chairperson, on page 302, I would like to ask this question. What is the social worker population ratio in the province, both in urban and rural areas? And the second one is on table 9.1, page 301, on the office of the MEC. What is the number of interns that are employed in the MECs, and whether the department can provide in writing the number and details of all interns that have been employed in the department and MECs office between 2012 and 2019. Page 305, sub-program 2.3. What support is the department providing for persons with disabilities, which are under the age of 60 years and living in facilities for older persons? I am aware 50-year-old who has been living in a facility in Gugulethu for over 2 decades. I think it was for 25 years, if I'm right, because I did a oversight there. And is now being evicted because he is underage. How does the department deal with such things? And 306 in table 9.2. What are the reasons for the budget cuts for older persons and persons with disability? And 309 9.3, table 9.3. Still, what are the reasons for the budget cuts for care and service to families? Still in 309, table 9.31. On the compensation of employees with regards to payments for overtime, how many times does it occur in the program that payments for overtime are delayed, and what are the reasons for it? 311, which is the last one. Given the GBV and substance abuse given in the above section, does the department think the budget allocated to this program, especially GBV, is enough? What measures are put in place to get more funding for this program? What is the budget for sub-program 0.4? Thank you very much, Chairperson.
I think you have captured with your officials all the questions.
I think
before I ask anyone else to ask, let's focus on these couple of questions first.
Thank you very much, Chair. The question, first question from Honourable Member Bakubakufos about the social worker to population in the province, the ratio in urban and rural areas. I don't know if we've got the breakdown with us. I'll just check whether Anami van Rieenen or Ramula Patel have that breakdown, but it is in the region of 4,700 to one social worker. But I'll ask whether either of them have that available. Otherwise, we'll have to give you a breakdown in writing.
Actually, can I respond?
Yes, you can.
We've got, remember the stats is 2 years back, census stats, that we're supposed to have the coal face 588 social workers. We're still working with that organizational structure, and we're already going for the second stats. So we way out in terms of the ratio, because we can't even fill all those 588 at the coal face. Yeah, so we were out for 2 years already.
But we don't have the exact numbers at this moment in time.
No,
So we'll have to ask the committee if they can send us a request for that in writing, and then we can provide that that data for them, because I think also the rural, it's different in different rural areas as well, depending on the region of the province.
Actually, we've got a shortfall just of social workers at Coalface of 147, based on the latest stats.
Thank you, Ms. van Reenen. So we are definitely falling short. I think the exact number has been given, but the ratio is as a expression of social worker to population is something we'd need to give a breakdown of per region. The second question from Honourable Member Bakubakufos, the total number of interns employed in the MEC's office. I think our MEC at present, I don't know if there are any employed in the MEC's office, but I'll ask Ms. Patel whether she's got that info. We did provide a written response to a parliamentary question to this effect as well, which I can read out in the meeting. I'm not sure if you would like me to do that, though, because it goes all the way back to 2012. Chairperson.
Minister will reply quickly.
So, just to say that that has been a parliamentary question for written reply. So there is a written response. I can confirm that in my term of office, we had one intern from Chrysalis who stayed for a month, and then she got a supervisor's post at Chrysalis and returned. And I do not have any interns working in the office, in the ministry. Thank you.
Thank you. You may continue, HOD.
Thank you, Chairperson. As I say, we do have the response to the parliamentary question. I'm not sure whether if I would read it now, but it has been. Otherwise, I can just send a copy to the committee to refer
forward,
to.
Forward the copy.
Yes.
Thank you.
And then the question from Honourable Member Bakubakufos around support provided for persons with disabilities living in facilities for older persons. I will ask Mr. Jordan to speak to that question.
Thanks, HOD. I didn't get the full question when the member asked, so I was not sure. I think it was something about people that's below the age of 60. I wasn't sure.
Yes, people living with disabilities who are under 60, who are living in older persons facilities. What support do we provide to them? And also, if there's an eviction, what support does social development provide?
Okay. Yes. So first and foremost, people that's below the age of 60 should not be actually within an old age home. An old age home is exclusively, according to the Older Persons Act, for people that's 60 years and above. We, however, do make exceptions due to the fact that you will find people that do not have any other accommodation or place to go because there is not enough disabled homes in this Western Cape province. So there's unfortunately the demand is very high. So it do happen that people land up in old age homes below the age of 60 that's disabled. The process would be that if there's any evictions, the department does not participate in that process specifically, and I will say now why. The board of an old age home, they do not belong to government. It's not government facilities. The board of an old age home is an independent organization. They're registered as per the NPO Act, and the board's got their own admission rules. They've got also their own rules within the house, and they've also got processes when eviction needs to take place. So the bottom line is we do not participate in those processes, but we will, however, as a department, if there's eviction taking place, there's two things that we will do if there's a complaint. The first thing would be that we will look if the eviction process took place correctly and according to the policies of the Old Age Homes Management Board. And secondly, we will also see if there's a solution that we can negotiate maybe and see if the person should not be evicted. What was the reasons? Can't we mediate and see how we can assist the person? And then thirdly, if it still does not work, mediation or anything with the old age home, then we will have to look for alternative accommodation for that disabled person. So we will then start assisting that person to find alternative accommodation. Thanks.
Thank you so much for those answers provided. Okay, let's move on. Honorable Foss had a number of questions she asked, and let me just do justice to all the other members. 305, saturated. I'm happy with that. 306, done. 307. No one, thank you. 308. 309. 310. Thank you. I don't see any hand. 311. Thank you. 312. 313. There's a hand. Honorable Windvogel, you may go. On which page is that? Let's help me.
313.
313. Thank you.
Yeah. Chairperson, on sub-program 5.6, what legislation guides the implementation of youth development in the province? And do we have a youth development policy? And what are the plans to increase the funding and add more projects for youth development? Thank you, Chair.
Honorable, HOD, thank you. You may answer that question.
Thank you, Chairperson. In terms of legislation and on youth development, I think it depends how youth development is defined, but obviously there's aspects of the Children's Act that are applicable around the youth, particularly older teenagers. And which is applicable in the social development sphere. But then there is also the legislation that's been developed around the National Youth Development Agency and so on. And then there is also the youth development policy in the province that was developed in the previous term. But I think we will. I will also ask Mr. Hewa whether he would like to add to this particular response.
Thank you, HOD. I think you covered very well. Thank you, Chair.
Okay, thank you, Mr. Hewa. I think also, as we indicated earlier, the youth strategy for the province is being driven and spearheaded by the Cultural Affairs and Sports Minister and Head of Department. So that is the nodal point. But we at the moment aren't able to expand services in this space significantly. With the budget cuts we're sitting at the moment, we can only really try to maintain and sustain what is already there. Thank you, Chair.
Thank you so much. Honourable Van Vogel, you're okay with that answer? Thank you. We move. I'm on page 314. Okay. Page 315. Page 316. There's two hands.
Yeah, sorry, you didn't see my hand on 315.
I'm with you right now, Ricardo.
Thank you, Chair. Mine is page 315, table 9.5. Given the fact of, given the need for gender sensitive budget, when will the department start having a budget and personnel to drive women empowerment initiatives in the department? Thank you, Chair. And perhaps, but I don't want to ask to repeat the question. Let me park there, Chair, because we can also make it part of our resolutions. Thanks.
Yeah. Honourable Foss.
Thank you, Chairperson. Mine is on table A2 on 390.
You're a bit far ahead of us again. But okay, yeah, we will deal with the annexes now. Let's park that one for later. Okay, Honorable Ricardo then.
Thank you, Chairperson. I was hoping I could also just do all my questions up to 319. Let me start on 315, Chairperson. Just at the bottom of 315, if we can just get clarity there, and perhaps me for my understanding. It talks about the funding over the MTF 15 million for food distribution centers and community nutrition. If they could just give a clear indication, what does that mean, food distribution centers? I know that you allocate money to NGOs, etc. But as far as I know, you don't have centers, or do you have centers that you store food? There's a bit of the wording is confusing me, but if you can just give clarity on that. And Chairperson, you said we can come back to the annexes later.
Yeah, thank you. HOD on Van Vogel, Honorable Van Vogel and Ricardo, please.
Thank you, Chair. On Honourable Member Van Vogel's question, the item or the program for women empowerment was introduced as on the budget structure a few years ago by the National Department of Social Development. It didn't come with any additional budgets or any additional provision for personnel to be added to the structure. So if we wanted to bring programs into that space, we'd either would have had to have broken staff away from another existing program and budget from another program and put it into that program, or otherwise we would somehow have to split one of the existing programs. So we opted not to do that at the time, because then that creates challenges in terms of splitting up teams. So the work that is being done in that space is carried in the victim empowerment program. So a lot of women empowerment work is done in the victim empowerment program, particularly in the shelters for victims of gender-based violence and domestic violence, particularly around assisting women to become economically independent and develop their skills and so on. So those projects are being done, but they've been done under the auspices of that program rather than splitting them into two separate areas. The sanitary dignity program is another example, and it was decided that we would keep that within a program where we already had a budget holder in place, because otherwise, again, it becomes difficult. So the programs are there. It's just that we haven't used the placeholder that was created in the budget structure for it. And then the question from Honourable Member Mackenzie around the food distribution centres and what that means. I'll ask Mr. Harewood just to clarify that. Thank you.
Thank you very much, HOD. Through you, Chair. Chair, the food distribution centres and the community nutrition development, it's the name of the line item. This is earmarked allocation from national. So the other provinces call these centers in different ways. In the past, in the province, we used to call them targeted feeding sites. So that will feed the distribution of community distribution center or of the food distribution center. Other provinces call them community nutrition and development center. So that is just a line item. It actually talks about what we do in the province, which is targeted feeding and our community nutrition and development centers. Thank you, Chair.
Thank you so much, sir. Okay, let's then move. 316. Ricardo and Honourable Ricardo, Honourable Philander, is that old hands or new hands?
Chairperson, okay. I just wanted to say perhaps that they should look at rewording that, because it creates the impression somewhere we're storing food in the Western Cape.
Okay, I think the HOD and the senior staff noted that. Honourable Philander?
Apologies, Chair. 317.
No problem. Yeah, we are there.
Thank you very much, Chairperson. Chair, in terms of table 10.2, information on training, I know, for instance, way back there was training provided for community councillors that would, through the welfare services, get necessary training and to supplement the support services to social workers. Are there anything to this effect part of this training program for the coming financial year? Thank you, Chair.
HOD?
Thank you very much, Chairperson. The training of community councillors is something that some of the NGOs are doing, and that we fund. But the department itself isn't currently doing training directly or employing community councillors. The other area, of course, where we do training as well is that that we also do training of the community-based child and youth care workers, which also supplement the work that the social workers do at community level. So that is something that we continue to do. And then training of social auxiliary workers as well, to work and assist with the social workers. So yeah, that it is something that's being done in some of the NGOs that we work with. Thank you, Chair.
HOD, thank you so much. 318 and 319. And that is it. I think from 319, it is the annexes. Yeah. 318, the first start of the annexes, table A1, and then we see 319. Honorable Foss, you want to ask a question?
Yes, Chairperson. Actually, I have a question for. Okay. Can I ask 3 questions?
You are most welcome.
Thank you very much, Chairperson. On table A.2, I would like to know what are the reasons for the high increase in budget for advertising. Still on table 31, I mean on page 319, table A.2, on the bursaries of employees. What are the reasons for the decrease on bursaries? And the last question is on 320, table A.2.1. What are the reasons for the decrease in the compensation of employees' expenditure? Thank you very much.
Honorable HOD, you may go.
Chairperson.
Okay.
3115.
Ricardo, you go first, and then we can ask the HOD to respond quickly. Thank you.
Thank you, Chairperson. That will be my final questions. I appreciate it. On 319 on the table, if one can just give an indication, the consultants and professional service went from 900,000 to 2.9. What is that increase of the 236% as indicated there? And then on training and development, there's also 1.5 million rand increase from 1 million to 2.6 million. And there was another item that I saw. And also there's a 20% increase on fleet services, including GMT, from 21 million to 25 million, a 4 million rand increase. One can just some details as to those increases. Thank you, Chairperson.
Thank you, HOD.
Thank you, Chairperson. I'll ask the CFO to speak to that set of questions from both Honourable Member Foss and Honourable Member Mackenzie.
Thank you, through you, Chair. I will start with some of the responses, and Mr. Holly can also assist me with some of them. The advertising, that increase there, as I've mentioned, we need to also now normalize going forward, and we have what we call the statutory adverts that we must place. So even in the regions and in the communities, we need to place statutory adverts. Child is missing, and we need to find the child, and so forth. So that is our cost that that drives that in most of the cases. In terms of that, our bursaries, yeah. Unfortunately, in terms of our bursaries, we cannot afford in the new coming year to issue new bursaries, and therefore we are just accommodating those that already have bursaries, and that we will pay them also for the number of years that they still have these bursaries going forward in terms of that. Our consultants and our professional services, that increase there. This was additional funding that we received to enhance our NPO system and also the mobile connectivity project that we received from the Provincial Treasury. And that funding then also speaks to the increase in terms of that. In terms of fleet services, this is mainly because of our monitoring and normalization, working towards the vehicles and having more vehicles again on the road, and increased engagements, monitoring, and those type of things that we need to do in terms of that. Training and development. Again, similar there in engagements, because for the last 2 years, Chairperson, we have been doing online or in-house training and virtual, and now we need to also then embark on face-to-face going forward in terms of that as well. I hope I've covered everything. Thanks, Chair.
Thank you very much. Thanks, CFO. Ricardo, is that an old hand?
Just a follow-up question, Chairperson.
Okay.
I understand the explanations on the motor vehicles and the trading, etc. But can I just get clarity on the consultant business service at extra 2 million? Are you saying you're paying Treasury the money, or you're paying consultants to implement their system? I didn't clearly get that. Thank you.
You may go.
Thank you, Chair. In terms of our normal operations, that is still in terms of what we do for what we call business and advisory services. But the increase here from 27 to 29 is mainly because of that additional funding we received, and those will be new projects that will start in the new financial year. I don't know if Mr. Holly just wants to elaborate on what the consultants and professional services.
Yes, Chair. In essence, we're using consultants in terms of development of the system itself. It will go through a procurement process and then activated from there. Like the CFO has indicated, it was for 2 areas: our NPO system that we're developing further, and then the mobile connectivity for our social work project.
Thank you. Honourable Mackenzie, you're okay with that?
Thank you, Chairperson.
Thank you so much. Let's then move on. I'm on page 320, page 321, page 322, page 323. No hand. You're quite comfortable and okay for now. Page 324, page 325. You see what's on page 325, all the municipalities and that sort of thing, payments to them, budgets to them. You can take note of that. Page 326, page 327, page 328, page 329, and then at the back, page 330. At this point in time, let me get to the public. I'm not sure. We could not establish if any public is with us online. Let's give it a minute. Any members of the public with us online, please identify yourself. Doesn't look like it. No submissions from the public and so forth. Let me then at this point in time ask first the HOD, and the Honourable Minister could then be the last person to make closing remarks. HOD.
Thank you very much, Chairperson, and thank you to the committee. I think that a lot of the implications and outcome of the budget is going to be unpacked as the year proceeds. And we will have chance again to go into depth with some of the issues when we sit with the committee again. But we thank you for affording us the time to come and account and provide information
you so much, HOD. Honourable Minister.
Thank you, Chairperson, to you, the honourable members on the platform. Ms. Jamse, thank you very much. As always, the debate, the questions are real, they're robust, they address the core issues. And as I said, it keeps me awake at night. And we are definitely going to need all the support that we can get as we go into this next financial year. And as always, Member Baku-Foss will know, my door is open, my phone is available. I would appreciate if members alert us before the time rather than wait for the sitting, but we continue to be accountable in a very transparent and dignified way. So thank you for your questions. I've recorded most all of them. We will certainly look at that and revisit as the year progresses. Thank you very much, Chair.
With the budget then now tabled, let me also use the opportunity to say to the Honourable Minister and her HOD, all the staff, CFO here with us and the others here with us, thank you so much for your detailed answers. I think that's the most important issue. You didn't try to cut corners. I think one can pick that up when people answer. No cutting of corners, straight to the teeth. Give us what we want, and I really appreciate that. And you may leave. The members have to stay for another minute or so. Thank you so much.
The refreshments outside, so they can have.
Those online, if you can rush to your office, there's some refreshments available for you. They know I refer to them as well. Please help yourself with some refreshments. I give you a minute to vacate. Thank you. Okay, members. While everybody is out of here, thank you so much for you two for your contributions. I really appreciate that. The professional manner in which you ask your questions, that for me was a highlight of this meeting. Let me ask if there's any resolutions, any recommendations from your side, Honourable Brankhuis.
Thank you very much, Chair. Chair, going forward, I would like the committee, in terms of resolutions, to, as soon as we have our next sittings, they will probably be in May, I assume, after the constituency period of April. The soonest availability of national social department, if we can have an engagement with them, and if we can have the national minister also present, and yes, with her department, because there's a lot of issues that that we need to have clarity on from the national social department. Thank you very much.
Got that, Honourable Van Vogel?
Yeah, Chair. Mine is on the, is it possible that the department can, they must investigate the number of child-headed households that were caused by the COVID-19 in the province and report back to the committee. And then secondly, on the sanitary dignity project, I'm not comfortable, if I was not, happy with the answer that I've got, or I was not clear, let me put it that way. So if I can get, how is the department going to, the reason why I'm asking that, Chairperson, is we went and visited a warehouse. There was a lot of sanitary pads of boxes. And I'm asking me, people are struggling in our different communities. And it was under social development. So now I really need clarity on that issue. How are they going to assist those girls who are in school? They are still the age of children who still need to be at school, but yeah.
Are you saying how are they going to
How
assist
assist
those
those
not in school?
not in school? Yes.
To access the sanitary
That's
pad. Got that?
Yes, Chairperson. I think I will park there, Chair.
Good. Anyone else?
Yes, Chairperson.
Oh, excuse me. Sorry, Member Force.
Chairperson, on the resolution, I request that the department give a breakdown of social worker to population per region and give details of shortfall of social workers. That will be my resolution. And to add on what Honorable Van Vogel is saying, they said in the NGOs, we are on the ground, we are visiting NGOs. Which NGOs it will be, we will be glad if they can even give us a breakdown which NGOs that they are distributing or giving the sanitary pads, because really people young women or young girls are struggling outside there.
Got
Thank
that.
you,
Similar to the one of Member Van Vogel. Okay. Let me quickly see. I don't see anyone else.
Yes, Chairperson. Online.
Please.
Thank you, Chairperson. I just wanted to get the list of the schools that they distributed last year's sanitary pads to, and the list of the schools they're going to distribute the next financial year sanitary pads to. Thank you, Chair.
Got that. And Honorable Philander.
Thank you very much, Chairperson. I'm covered by Member Mackenzie in terms of who the beneficiaries are of the project. Chairperson, members would also remember us visiting that storage facility. And based on that visit, there was a request made by an old age home in Paarl East to actually use that facility. Chairperson, I just, with your indulgence and that of the committee, that we kindly place that matter back on the agenda, because as far as I know, we have not yet received feedback what the process are and how far that request was for using that specific facility that is currently used for as a storage facility for the Dignity project. Thank you, Chair.
Are you asking if that we need to try to find out if that facility are still in use?
What I gather from the department, it is still used as a storage facility to store the pads that they distribute. So there was a supplementary request to use that facility by an old age home.
Okay.
So yeah, if we can just establish how far in the process is that request, please, Chair.
Got that. Thank you.
Thank you.
The last one.
Honorable Van Vogel first. And
yeah, Chair, if we could also get a list of NPOs who are going to be affected for this financial year, Chair.
If you say affected, how?
Remember, they were saying there is going to be NPOs who will not get funding, and then those.
Oh, that's what you mean. Those not get funding.
Yes.
Thank you.
Yes, Chair.
Honorable Force.
Those who are getting funding now won't be. Yeah, there's some of them they will get less. They won't withdraw their funding to all NPOs that they are already funding. But what are they going to do? If I captured them very well, Chairperson, they said the NPOs that they are funding now, they won't be affected. But if they have maybe some shortfalls, they will try to decrease from them, or those who are not complying won't be helped anymore if I capture them very well.
Let's ask the question and see what is the
I
answer we're
think.
going to receive from.
And the second one, Chairperson,
The resolution of member Van Bochel, what are we requesting from
The list of NGOs not to receive any more funding from the department. Van Bochel, am I right?
Yeah.
Thank you. They used to receive.
Yeah, they used to receive.
And you understand Honorable Voss's question?
and the last one, Chairperson, I think I'm just thinking now, I think the MEC didn't capture me very well because I was asking about 2012 to 2019, 2012 to 2019 interns, not current interns on her office.
Okay.
2012 to 2019.
So number of interns employed by the, is it by the department and in the office of the MEC?
Yes.
Is it department and MEC's office, both?
In the MEC's office from 2012 to 2019.
Number of interns employed in the office of the MEC between the period 2012 to 2019.
Yes.
Got that. Okay, thank you.
And there was also a breakdown list of the 26 funded GPV shelters in the province. Do you still need that?
Yes.
Breakdown list of 32 shelters for homeless adults across the province. List of schools that will be beneficiaries of the sanitary.
I think Mrs. Hussein had given a sort of an answer with regard to hotspot shelters in the metro. It is, she said she would like to give an answer in writing with regard to which shelters in the metro we regard as hotspot shelters.
Shelters.
And okay, to add on that,
yeah,
and why they regard those
shelters
as hotspot.
Shelters.
Okay, we've got that. May I then ask at this point in time, are we accepting the budget as read and as tabled?
Yes, Chairperson, we accept.
Support, Chair.
Okay, thank you.
Chairperson, I'll jump.
Yeah, I love to my friend, the ladies first.
Oh.
Thank you, Chairperson.
Let me protect the ladies.
Thank you, Chair. Thank you, Chair. Thank you, Chair. My hand was up first. Thank you, Chair.
Okay, I will get to you, Honorable Philander, right now. Honorable Voss.
Thank you, Chairperson. I would like to register our minority vote. We are not.
Okay. I understand.
Yeah, thank you.
You know I understand. Brinkhuis?
Thank you, Chair. Also, Al Jamaa wants to express their minority vote, not to support the budget.
Thank you.
Thank you,
Honorable Philander, please.
Expressing my support for vote 7, Chairperson. Thank you.
Okay. Let me just read this. Yeah.
I just want to check because I see we are just supporting. We don't know in favor how many is in favor and how many is not in favor.
We already said in
Perhaps,
favor.
No, you are only
two.
Are
two. We are
and
three.
So I'm just checking if you are in the house.
With me, it's number 3. So you guys are not gonna get away with that. Okay, let me read this. I have to do this officially before we close finally. I see we're well within our time span. We save about an hour. We've done well. Committee report. Report of, let me read the reference number as well, 11/4/11/2. Report of the Standing Committee on Social Development on vote 7. Social development in the schedule to the Western Cape Appropriation Bill. B2/2022, dated 17 March 2022 as follows. The Standing Committee on Social Development, having deliberated on the subject of Vote 7, Social Development in the schedule to the Western Cape Appropriation Bill, B2/2022, referred to the committee in accordance with Standing Rule 188, reports that it supports the vote. Minority view, in accordance with Standing Rule 90 actually, the African National Congress and Al Jamaa expressed their minority view to not support the vote. Is that acceptable? Thank you. You agree? Thank you. Then I can sign this document off.
Thank you, Chairperson.
Guys, that ends then this session. Thank you so much for your dignified manner in which all of us conduct ourselves. It's highly appreciated. Keep well.
Thank you for Chairperson. No chair, much appreciated.
I'm waiting, member.
Bye-bye, Wendy.
Goodbye, member.
Member, I'm waiting.
Yes, yes, yes.
Okay,
We'll
bye-bye.
do so now. Thank you. Bye.